So today we will see like chapter number 10, okay, nervous system. So in this we will see introduction, then general structure, nervous system, neuron, nerves, glial cells, spinal cord, meninges, body meninges, and terminologies, all this thing. Okay, this is the basic structure of our body. No need to see. So here, like fiber exiting from microscopic nerve cell neuron. Okay, are collected into microscopic bundle called nerves. Okay, so like fibers make the nerve cell neuron, and they are collected into the microscopic bundle called nerves. So multiple nerve are nerves. It becomes nerves. And acetylcholine is the chemical. Okay, we will see all these things in this picture. Acetylcholine, the discharge of this cell. Okay, so if we read this, the external stimuli as well as internal chemicals, such as it is a chemical, acetylcholine, it is a chemical. Okay, that activate the cell membrane of the nerve system, which result in electrical discharge of the cell. Okay, they provide the electrical discharge. So this electrical discharge nervous impulses may then transverse the length of the associated nerve. Okay, then this is transmitted. So external receptor sense organ. This is a sense organ. External receptor. Mean receptor it is a sense organ. Okay. As well as internal receptor in muscles and blood vessels receive the impulses. Okay, so we will see in this picture in detail. So like general structure nervous system, it is the nerve system is classified into two major divisions. The central nervous system and the peripheral nervous system. This is the main. Okay. So like there are two classification into two major division. Okay. This is our nervous system is divided into two part. Okay. Central nervous system and peripheral nervous system. Okay. So central nervous system consists of the brain and spinal cord. It is consists CNS. Central nervous system. It is made up of brain and spinal cord. Okay. That like handle the entire body. Okay. The peripheral nervous system consists of cranial nerve, spinal nerve, plexus, peripheral nerves. Okay, that is our peripheral nervous system. So we will see in diagram, then we will understand it better. So the one exception is the 10th cranial nerve called the vagus nerve. Okay, it will come in diagram. Okay, then we will understand it better. So like here, this is brain our top. Okay, we know that cervical, thoracic, lumbar, sacrum. Okay, and uh, product vena coccyx like. So like in this na cervical, the level of cervical is C1 to C8. Like okay, it is 7 level. Okay, 1 to 8. It is 7 level. Thoracic now is 1 to 12. Okay, so cervical, thoracic, lumbar is 1 to 5. Sacrum is 1 to 5, and coccyx is the last. Na it is 4. The cervical plexus are in at the top left hand side. You can see from that much of portion. Na, it is cervical plexus. Okay. Brachial plexus after the brachial come in our shoulder. Okay, it is brachial plexus, shoulder area, and spinal cord. We know that spinal cord is the back side of our cord. Okay, collection of nervous system is spinal cord, and a spinal column is the collection of our bone. Lumbosacral plexus it is it's come in a lumbar region. Okay, lumbar region. It is that's why we call lumbosacral plexus. The nervous system. Femoral nerve is come in our leg, and sciatica nerve it is come in our leg. Okay, the sciatica nerve is this side. This is the sciatica nerve, and side of this sciatica nerve system it is femoral nerve. Okay, so sciatica femoral both are in this. The brain and the spinal cord, spinal nerve, and the spinal plexus. The femoral nerve is a lumbar nerve leading to and from the thigh region. Okay, So we can see seminal nerve and this all this thing, okay, which come from which direction to the which direction it is going. Okay, product vena is the last now. No need to go in this. So like here, our brain. So our brain handle multiple part. So what handle that we will see. So like in this here, optic nerve, na, optic nerve will come from this side. The arrow made na from there. Okay, so it is optic nerve. Our eye nerve. Okay, olfactory smell. Olfactory means our related to our nose. The smelling thought it come from olfactory. Okay, oculomotor, trochlear, abducent. This is the oculomotor is come in our eye moment. This is also trochlear is also our eye moment. Abducent is also our eye moment. Okay, so this all these three na will come in our from this area. Okay, for our eye moment. They provide the eye moment in signal. They provide a signal for the eye moment. And the facial nerve comes from here. Okay, like facial nerve, no? Like facial scalp movement, taste, ear sensation. That facial come from this part, nerve system. We can say this nerve system come from here, from our brain, like glossopharyngeal. Glosso mean our tongue. Pharyngeal, we know that pharyngeal, the tongue and throat sensation. Okay, throat movement, pharyngeal. This comes from here, accessory, spinal accessory. It is spinal accessory. So that comes from here, like swallowing, head, shoulder movements that come from here in our brain. Then after this, vagus provide like peristalsis thought, blood pressure, heart rate, coughing, sneezing that handle that part. Okay, so that come from that handle from this side of this part of our brain. You can see vestibular, vestibulocochlear, auditory, hearing and balance. So the vestibular help in hearing. So that comes from here. The vestibulocochlear auditory it is help from in auditory. Trigeminal nerve like forehead, skull sensation, cheek sensation, chewing that comes from here. Okay, that we will call trigeminal nervous system trigeminal. So cranial nerve is 1 to 12. Sensor, apparent, sensory or apparent nerve are colored blue and carry measure toward the brain. Towards the brain, it will go towards the brain. The sense part, na, one who we will touch and that touch thought will come in our brain, na, that is apparent. Motor efferent nerve are colored red and carry messages from the brain to the muscle. So which signal come from brain to muscle, na? Okay, it is colored in red that carry the messages to the from the brain to the muscle. Okay, also we can say motor or efferent. Okay, so this is the two thing. Plexus is what? Plexus is a large network of nerve in the peripheral nervous system. The cervical, brachial, and lumbosacral plexuses are example that include cervical, lumbosacral nerves. Okay, there are other plexuses in the body, networks of the intersecting blood vessels. So other plexuses are also in our body. Okay, that intersecting blood vessel, vascular and lymphatic vessel. No need to see. Just see the word and meaning of that. So the inclusion. Okay. Receptor mean they take the signal. Okay. Like receptor, our eye, they take the signal, they see and just provide the signal to the brain. Hearing is also receptor. Balance ear is also receptor. Smell come from olfactory. Touch come from a skin sensation. Sensory come from afferent nerve that carry the message related to the changes in the environment toward the spinal cord and brain. Afferent means providing signal by touching to the brain. Okay, and the efferent which show this travel from the spinal cord and brain to the muscle. So the like from inside to outside, na? that is a motor efferent. Okay, and from outside to inside, the signal goes. It is afferent sensory nerve. Automatic nervous system are there. The peripheral nerve belong to the automatic. Some autonomic nerves are sympathetic nerve and other are parasympathetic nerve. The sympathetic nerve stimulate the body in times of stress and crisis. They stimulate the body at a time of like stress and crisis. Okay, that is sympathetic nerve. They increase heart rate, forcefulness. Okay, they indicate like this is a sign of our becoming our increased heart rate. We got like suddenly we got shocked. Okay, this all the thing our body now they react. So that is sympathetic. Parasympathetic nerves normally act as a balance for the sympathetic nerve. Like parasympathetic nerves slow down the heartbeat, lower blood pressure, and stimulate intestinal contraction to clear the rectum. Okay. So parasympathetic nerve system, na, it makes normal to our body. Okay, it makes the body normal. When anything happens, suddenly so we got shocked. So like parasympathetic and sympathetic even in this. So like when the parasympathetic happen, na, so like in this our pupil become dilated, our eye ball become dilated. Salivation inhalation will increase or what increased respiration system, it will increase bronchial passage dilated. Okay, our bronchial passages, our track of bronchial, it become dilated. Increase heart rate, it increase the heart rate. Increase secretion of sweat gland. Okay, like hair follicle rate, goosebump. Our hair follicle rate now and goosebump when anything suddenly happen. Secretion of adrenal hormone become also. Digestion inhibition become also. Bladder muscle delayed. Okay, and in this na parasympathetic. When we got excited and all the things will increase, na, then this parasympathetic make them slow down. Okay, normal. Like pupils constriction. Okay, constricted like no constricted. Pupil mean constricted mean become small. Normal. Okay, salivation stimulated, that is happening. Inhibited and stimulated. Okay. Decrease the respiration and the bronchial passage constricted. Decrease heart rate, they make heart rate normal and this digestion stimulation also. Blood. So this will make normal our body. Central nervous system is brain spinal cord. Peripheral nervous system is cranial, spinal nerve, autonomic system. Okay. Autonomic system, we have two nervous system, parasympathetic, sympathetic, and parasympathetic. So division of the central nervous system is central nervous system, and the automatic nervous system is part of the peripheral nervous system. The automatic nervous system is peripheral nervous system. ठीक है, sympathetic, parasympathetic. It is autonomic nervous system. Sympathetic, parasympathetic. It will automatically will happen. Okay, we can't control on this both. Nervous, neuron, nerves, and glial cells are there. The neuron is an individual nerve cells, a macroscopic structure. Impulses passes along the part of the nerve cell in a definite manner and direction. Okay, so that neuron, na, they are providing impulses sensation. Impulses passes along the part of the nerve cell in a fixed manner. Okay, the part of the neuron are pictured. Okay, we will see like this is a neuron. Okay, we will see how they transmit the signal. Part of the neuron and the pathway of the nervous system. Parenchyma mean essential cell. Okay, important cell. This meaning is this stimulate. So like here when we are touching anything, so it comes stimulate. Number one stimulate. They provide the sensation and nucleus. Okay, then it will travel like this, and like it will travel, and there is a gap in between that. You can see neurotransmitter is there. So neurotransmitter is there here in the big picture. So in this action terminal and fiber are there. The impulses, nerve impulse come and it will provide like this in a small like receptor. Okay. So here, on another side, now it is a receptor. So they will catch the signal, okay, and provide the nervous impulses. So A number is stimulating begin an impulse in the branching. Number one is stimulating the here. They are touching and providing the impulses, which are called dendrite. The number one is dendrite, okay, which is catching the signal. A change in the electrical charge of the dendrite membrane that is then thus begun. And neuron impulses move along the dendrite, like the moment of falling dominates. The impulses traveling in dendrite like the moment of the falling dominant. So here the impulses will traveling, okay. If it traveling in only one direction, the impulse is traveling only in one direction, Nash reaches the cell body. Second is the cell body, they are traveling the signal, cell body, then which contain a cell nucleus. Third number in cell nucleus, inside of the main, in this a small collection of nerve cells, bodies outside the brain and spinal cord are called ganglia. Okay. So small collection of nerve cell, na, bodies outside the brain and spinal cord are called ganglia. So extending from cell body is the action. So okay, this is the action. The transmitting, helping in transmitting, which carry the impulse away from the body, cell body. They are taking the impulse for the next part, next level. Axons can be covered with a fatty tissue, not important. The purpose of the myelin sheet. Number five is the myelin sheet. This is a myelin sheet, like covering something kind of cover the neuron system. To is to the insulate the axon and speed transmission. Okay. So they are increasing transmission, electric pulses. Okay. Okay. You can just read all this, you will understand. Okay. Number six is terminal and fibers of the nervous system. The nervous impulses pass through the axon to leave the cell via the terminal and fiber. It is also helping the same manner. Terminal six number, terminal and fibers it is. Then another called synapse, the space where the space where the impulse jump from one neuron to another called synapse. The number seven is synapse, where the impulse is jumping from one side to another side. Okay, it is synapses. The transfer of the impulses across the synapse depends on the release of a chemical substance called a neuron transmitter. This is a transmitter, neuron transmitter. It helps in transmitting the signal. So, like it contains neuron and it's located in the end of neuron, and they release the neurotransmitter into the synapses. Okay, acetylcholine, sorry, epinephrine, non-epinephrine, epinephrine, adrenaline, dopamine, serotonin, and endorphin are called example of neurotransmitters. So these all five are neurotransmitters. Okay, they help in transmitting the signals. Then where the neuron is a microscopic structure within the nervous system, a nerve is microscopic, okay, or able to seen with the naked eye. So, okay, afferent we have seen this afferent and efferent. Okay, so like the receptor, like the skin, eye, ear, nose, they take the signal to the brain. It is afferent or sensory nerve, and that carry take out the signal from brain to the muscles, no, or body toward to the body, brain to the body, no. It is efferent or motor. Okay. Parenchyma is an essential nerve. Okay, nerve are the parenchyma. And nerve are the parenchyma of the neuron system. Essential tissue cell. Stroma is also of an organ in the connecting supportive tissue of organ. Stroma is also essential. Stromal tissue of the central nervous. Sorry, stromal tissue. Stroma. Okay. So stroma of an organ is a connective and supportive tissue. It is of an organ. The stromal tissue of the central nervous system consists of the glial cell. Nothing important in this. It is a helping tissue. Okay, main part tissue, essential tissue. Astrocyte, like there are four type of supporting or glial cells. Glial cells or supportive cells are four types. Astrocyte, astroglial cell, we can also say macroglial cell, oligodendroglial cell, and its ependymal cell. This is the essential. Okay, this is the small cell and many branching. Four type of supporting glial cells are supporting cell, important cell we can say. So like astrocyte, astroglial cell is like this, macroglial cell is like this, oligodendroglial is this, ependymal cell is this. Nothing important in this. Blood-brain barrier. Okay, so like they are barrier. Barrier means like making any kind of protection. Okay, so like protective barrier between the blood-brain cells called blood-brain barrier. It is a barrier. Okay, obstructing or protecting, stopping anything. The brain, we know that control the body activities entire in human body. Okay, so like the largest part of the brain is the thinking area, that is cerebrum. The cerebrum is the brain, large brain part of our body. Cerebral is a like the nervous cell lies in sheet which make up the cerebral cortex. Cerebral means the outer surface, like okay, surrounding area related to brain. This sheet arranged in fold called gyri. So it is called gyri and sulci grooves. Groove known as sulci. Okay. So they separate from each other na, by groove known as sulci. We will see in diagram, then we will understand, which is called cerebral hemisphere. The right side and the left side, na, which is called cerebral hemisphere. Okay, so we have the brain. This is brain structure. So you can see that there are five types are there in this. Many types are there, like the frontal, cerebral. Here the occipital. The here that part, na, it is occipital lobe. Okay, then parietal lobe are there that handle the body sensation, visual, and s- spatial perception. Then frontal lobe is there here that control the thought process, behavior, personality, emotion, and like temporal lobe here downside. Okay, that handle the hearing, understanding, speech, language. Broca area is language expression. Broca is this, and sulci and gyra is this. Okay, so sulci divide like this. This the part of our brain that show in a upward. Okay, that is in a random direction, and which is dividing in a, it is called sulci of that area. Okay, the gyri and sulci also body movement come from here. Wernicke area is this. So like which make up the cerebral cortex, the sheet arranged in a fold called gyri. So here the sheet arranged in a fold. Okay, that is gyri. It is a sheet that is arranged in a fold and separated from each other by a groove known as sulci. That is separating. Sulci is separating. So the left cerebral hemisphere, gyri, this word come in a brain when the doctor make the report, left brain, all this. In the midline, the cerebrum are space or canal called ventricles. Picture picture number 10 to 8. Ventricle are there. In the middle of the cerebrum are spaces or canal. The canal called the ventricle. The fluid is cerebrospinal fluid, we will say. Lumbar puncture, they do the lumbar puncture to take out that fluid to test or anything. So like here, we have the brain like cerebellum is a small brain, cerebrum is a big brain, ventricle is the empty area, like brain contains fluid. Okay, that is empty, that's why it contains fluid. Membranes around brain called cerebrospinal fluid. Okay, here also fluid is there. membranes around the spinal cord contain CSF. Okay, here also fluid, cerebrospinal fluid. Circulation of cerebrospinal fluid in the brain ventricle around the spinal cord. Nothing important. So like there are two important part of our brain are thalamus and the hypothalamus. Thalamus acts like a trige center. It decides what is important and what is not. It decides. Thalamus will decide what is important, what is not. Okay. Selective process, relaying sensory information cortex to the cortex, cerebral cortex. Thalamus also play a major role in the maintaining. Okay, nothing important. Okay, uh, hypothalamus, hypomen below. So hypothalamus, no, it below the thalamus. Okay, contain neuron that control body temperature, sleep, appetites, and all these things, emotions, and this. Okay, like it. So this is you can read in a detail. You will know nothing important. This thalamus, hypothalamus, both are working. Then here basal ganglia is this corpus callosum here, thalamus you can see here, and hypothalamus below the thalamus. Pituitary gland is below the base of the skull, below the base of brain. Midbrain here, pons here, medulla oblongata here. Okay, that is the brain stem. This combination, na, all three brain, midbrain, pons, medulla oblongata it is brain stem. Cerebrum is the last side you can see. Cerebellum is the small brain. Okay, so cerebrum is a large brain, cerebellum is the small spinal cord here. So cerebrum, thalamus, hypothalamus, cerebellum, midbrain, pons, medulla oblongata, all these things. Midbrain, medulla oblongata, cerebellum. Nothing important. Just see this. This is the part. Pons is a part of our brain stem that literally means bridge. It contains nerve fibers, tracts that connect the cerebrum. They contain nerve fibers and tracts, pons, okay, that connect the cerebellum cerebrum, both connecting due to this. Medulla oblongata also in the brain stem connect the spinal cord with the rest of the brain. They also help in connecting the spinal cord. All are helping, just transmitting and connecting. Respiratory center, cardiac, vasomotor, we know that all this you can read this. Cerebrum, like thinking, personality, sensation. Thalamus is a relay station for sensory pulses, control awareness. Hypothalamus, body temperature, content, body temperature, and all these things. Cerebrum, coordination of voluntary movement and balance. Pons, midbrain, it connects the nerves and nervous fibers. Medulla oblongata, nerve fiber cross over left to right to left. Spinal cord is a column of nervous tissue extending from the medulla oblongata to the second lumbar. So it is a column of nervous tissue extending from the medulla oblongata, like brain, from the brain, inside from the brain, to the second lumbar vertebra, to the downside, like, okay, in a body. So below the end of the spinal cord na, is the coda equina. It is the last part of a brain, sorry, a spinal cord, okay, like coda equina. It is the last. And the spinal cord reveals an inner region of gray matter containing cell bodies and dendrites, and on outer region of the white matter containing the nerve fiber. You can just read, you will know. Gray matter is here, central white matter. Gray matter, white matter we have in our brain. Posterior, mean dorsal or posterior, both are same. And anterior mean ventral, mean front side. Okay, dorsal, posterior mean back side. So like they are providing the afferent, in afferent we are touching and coming the sensation to the brain, and in efferent from the brain it is uh, traveling sensation to the muscles. Okay, we have already seen and read this. Here the main is our brain stem is brain here. Scalp is there, outer surface layer. Cranial is skull. Okay, containing cerebral spinal fluids, spinal cord. So like see in this first number is dura. The outermost membrane of the meninges na, is the dura. So here the meninges, we will say meninges means gap. So dura mater is one. Okay, five meninges are there. The dura mater is one. Okay, it is a layer and thick thought membrane content channel dural sinuses are content. But okay, second number is subdural spaces. It is subdural spaces. Second number, you can read also second layer surrounding the brain and spinal cord is the arachnoid membrane. Third number, not important, just read and see. It is a layer. Subarachnoid space is the four numbers is this and five number is pia mater. They all are helping. Okay, it is the outer most membrane and sorry, it is a membrane. Okay, of the meninges. These all five are meninges. Okay, layer, main layer you can say. So here, like acetylcholine, it is a neurotransmitter chemical. We know that it is a chemical. Afferent nerve, we know that carries message toward the brain. Okay, and arachnoid membrane is the middle layer of the three membrane. Arachnoid is the layer. Astrocyte is the cell. Okay, glial cell. Autonomic nervous system is the nervous system controlling voluntary body function. Okay, involuntary to whom we can't handle. It will act. It will do behave automatically if anything happen. Action like microscopic fiber, body brain barrier is a protective separation between the blood. Okay, brain stem, you know that cortical is last part of our spinal cord. Okay, collection of the spinal nerve below the end, cell body, central nervous system. We saw cerebellum, posterior part of brain, cerebral cortex is the cortex outer region. Okay, cerebral spinal fluid, it is fluid. Okay, that surround the brain, and cerebrum is the large part of brain. Cranial nerve is the nerve carry message to and from the brain to all part of body to all part of head neck. Dendrite is the microscopic branching. Dura mater is a thick outermost layer. Efferent nerve is the carry message away. Okay, ependymal cell is this glial cell. It is ganglion collection of the nervous cell. Glial cell, gyrus, gyri, hypothalamus, portion of the brain. Hypomen below thalamus. Okay, below thalamus. Medulla oblongata, part of brain, manages three protective membrane that surround the brain. Okay, it is a protective membrane that is manages macro macroglial cell, phagocytic glial, midbrain, uppermost part operation, motor nerve carries messages away from the brain, myelin sheath covering of white fatty tissue, nerve mean macroscopic cord like neuron mean nerve cell that is necessary, neurotransmitter oligodendroglial cell, parasympathetic nerve, involuntary autonomic nerve. So parasympathetic nerve means like involuntary autonomic nerve that regulate normal body function. Parasympathetic it behave automatically. Okay, like heart rate, breathing, muscle, parenchyma, essential tissue, peripheral nervous system, pia mater, thin dedicated inner membrane. Pons is a part of brain anterior to the cerebellum. Receptor organ of that receive and transmit stimulate. Sciatic nerve is it is in our leg. Okay, nerves extending from the base of the spine. Sensory nerve carries message toward the brain. Spinal nerve we have pair of nerves. Stimulus agent of changing in the stroma connective tissue supporting tissue. Stroma is the connective and supporting tissue. Okay, sulci mind depression group. Okay, sympathetic and synapses space through which a nervous impulses travel. Thalamus is the main relay center of the brain. Vagus nerve is the 10th cranial nerve. Okay, cranial nerve it is ventricle of the brain. Like ventricle is the canal of the brain, okay, that contain the cerebrospinal fluid, that contain the fluid. So cerebello, like cerebellum related to our brain, okay, cerebellum related to our brain, cerebellum, cerebellum, both are same. Cerebro, like cerebrum, those related to the brain also. Cerebrospinal fluid, we just seen, it is a fluid in our brain. Cerebral cortex, it is related to brain. Cortex mean outer layer of our brain. Dura mean subdural. Hematoma, like hema mean blood, toma mean tumor, tumor of the blood tumor, which is in our dural space, subdural space, okay, a place. Epidural, epidural mean above, epi mean above, dural mean related to brain, okay. Dural matter is there. The dural matter it is available in our brain. So epi mean above the dural hematoma, like tumor. The tumor happen above of this dura matter. Encephalo, like brain, encephalitis, inflammation of brain, encephalopathy, bad condition brain, and encephalopathy. And mean without encephalopathy, sorry, encephaly mean without brain, without brain. The person happen without brain. Okay. That is a congenital brain malformation not compatible with the life may be detected. Glial mean glial cell, glioblastoma, tumor of the glial cell. Okay. Malignant tumor. Leptomean thin slender, leptomeningeal mean thin slender, like thin area. Meningeal mean we have just seen the meninges, na. So there, the pia and arachnoid membrane are known as the leptomeningeal. Okay. Meningo. Meningo mean membranes like meningeal, related to meninges. Meningioma mean tumor of meninges. My mean muscles. Okay. Cilia. So like nerve tube, myelomeningocele. Neural tube defect caused by failure of the neuron tube to cause during embryonic development. The undergoing of infant born with spina bifida. The spina bifida also happen in this. Okay, that is the abnormality condition of spinal cord. Okay, not providing nutrition and got damaged. Like so, myelomeningocele like muscles of this meninges and cilia happen like abnormality happen in this. Myomin muscles, myon neural, the muscles of the neural system. Myelo mean spinal cord, mean bone marrow. Myelopathy, like abnormal condition of the muscles. Poly, poliomyelitis, the inflammation of the muscles of the polio. Polio means gray matter. Okay, it's a gray matter. Neuro mean nerve. Pathy mean abnormal condition of this nerve. Polyneuritis mean multiple inflammation of the nervous system. Poly mean multiple. Pons mean pons. It is in our brain. Cerebellopontine. So related to cerebrum, and pontine, like pons area. Radiculo mean nerve, root of the spiral. Radiculopathy like something paining, okay, in nervous system. It is not good, like pathy, abnormal condition. Sciatica is a radiculopathy affecting the sciatica nerve root in the back. So it is a pain. Radiculopathy affecting the sciatica nerve, okay, in the back. Herniated disc is a common cause. Herniated disc is also a common cause leading to pain. Herniated means just come out something from our spinal column to the outside, toward the outside. Okay, like anything. Radiculitis, like inflammation of radicle, it contain often result in a pain and loss of function. Thalamus, which shows just in this thickle, thickle like sheet. It is layer that covers something. Okay. The intrathecal injection, it is injection and intrathecal, like inside, put inside. Okay. And vagus nerve means our 10th cranial nerve. It is. Here, subdural hematoma, you can see. Here, the hematoma, tumor happened of the blood, okay, in the subdural region. Okay. Epidural mean top to the top, it is okay. The tumor happen in the top, and intracerebral hematoma intra mean inner, okay. Blood tumor happen. So subdural hematoma, epidural hematoma, intrathecal, all this in here like allergies, algesia, like sensitive to pain. Allergies mean pain. Analgesis, if we say analgesia mean and mean like without, algesia mean pain, without pain. Okay. Hypoalgia mean pain, happening pain below anything. Okay. Hypo, diminished sensation to pain. Notice that the O in hypo mean it drop, like dropping pain. Okay. Hyper mean increasing sensitive pain. Okay. Algia mean pain. Neuralgia, nervous system pain. Trigeminal neuralgia, trigeminal involuntary flex. The happening pain in a trigeminal area. Cephalgia mean pain happening in the cephal, like brain. Headache mean we can say. Cause burning. Causalgia, the burning pain. Okay. Comet, it's comatose. Like coma is a stage of unconsciousness from which the patient cannot arouse. Coma. Coma is a stage of unconsciousness. The coma happen where the people don't know what is happening. They can't respond. They can't say anything. Just put and go, become relaxed forever. Aesthesia, like feeling nervous sensation. It is anesthesia. It is nervous system sense feeling. So without feeling like this. Okay. Lack of normal sensitive. You can read in this also. Hyperesthesia. Paresthesia is the para. Main abnormal paresthesia include tingling, burning, and pain and needle sensation. Para, paresthesia. It is also the same. Okay. Like we don't know like anything happen. This anesthesia, paresthesia. So in this anesthesia, lack of normal sensitive sensation. Okay. And paresthesia mean abnormal paresthesia include tingling, burning. So like our hand and our body part, no, it will shake. Okay, we can't control their shake, their movement. Okay, they shake repeatedly in multiple times. Okay, in a second. Kinesia, okay, movement. Kinesia means movement. So brady means slow. Braid means slow. Kinesia means slow movement. Hyperkinesia means large movement. Dyskinesia means difficulty in the movement. Okay. Akinetic means without movement. Okay. Lapsy like seizure. Epilepsy like epilepsy happen na. Epilepsy. We know that epilepsy it is seizure. Okay. In which na the people become uncontrollable, like unconscious, like they will go in a sleep or any type of unconsciousness. Sudden uncontrollable compulsion to sleep. Okay. Suddenly they become sleep. Narcolepsy also. Lax means word phrase. Dyslexia means a difficulty in okay development reading disorder occurring when the brain does not properly recognize, process, interpret language. It is a developmental reading disorder. It is disorder. Okay, in which the person feel difficulty to give the response. Okay, Paras- paralysis weakness. It is hemiparesis is a weakness. Hemi means half area, affecting either right or left half of the body. Paralysis also is used by itself to mean partial paralysis. Partial means half. Okay. Hemi means also half. Aphasia, speech. So aphasia without speech. Okay. Can read in a detail also. Plagia, paralysis. Hemiplegia like become affecting half part of our body, half part of our brain. Okay. They they affecting with the paralysis happen. Okay. Paraplegia, para mean both side happening. Quadriplegia, all four side. Okay. Praxia, action. Apraxia means without action. Okay. Asthenia, strength. Neurasthenia. So neuro is asthenia. Nervous system strength it is meant. Syncope to cut off, cut short. Syncope. The syncope means fainting. Mean newly born brain partner, newly made up of our brain partner. Suddenly and temporal loss of consciousness caused by the inadequate flow of blood. So like the blood is not providing to the brain, that it happens in copy for a short period of time. Text mean order, ataxia mean coordinating, like without coordinating. Condition of decreasing coordination. Okay. So here, this is a site of our administration of spinal anesthesia. Here give the anesthesia. Okay, it make all entire body sleep down. So it is a dura and arachnoid membrane here. Subarachnoid space is here. You can see epidural space is this here. Okay, epidural and spinal subdural block. Okay, here they were making the block by putting anything, injection and liquid. Here they make the sleep to the people. The position of the part of spinal anesthesia, cross section view, spinal cord showing injection, epidural. Nothing important. You can see mile and myelo. Don't confuse in this word. Like myelo mean myelo. Myelo mean spinal cord or bone. Myelo. Okay. And myo mean muscles. Okay. We know that myo and pyo. Pyo mean pus. Okay. Neuropathies. Pyloneuropathy is nothing important in this. Congenital degeneration factor. Nothing important. So like congenital disorder are there this type like hydrocephalus mean accumulation of the fluid in our brain stem. Okay. Spina bifida mean like congenital defect it is in the lumbar spinal cord caused by imperfect union of vertebral part. It is a congenital defect in our lumbar region happen which will make effect in our entire body. So it is spinal bifida occulta. So like spinal bifida means making spine bend at some extent. Okay, it is showing now. We can see this bending of spinal cord. It is spinal bifida. Like we can say cupboard happen. Na? Sometimes people cupboard like this. Spinal bifida cystic with meningocytic. So here spinal bifida happen due to the cystica. Like something come out like liquid or pus or nervous system come out from the by breaking that area and come out. They come out to the outside. Okay. So like here spinal bifida we can see like neural tube defect, spinal bifida cystica, myelomeningocele, myomin muscles, meningocele is the we just seen. Here Alzheimer disease happen in our brain. So what is the disease happen? So Alzheimer disease it is brain disorder. It is marked by gradual and progressive mental deteriorating dementia. It is deteriorating dementia. Brain disorder it is. Okay. Anything could be damage in this would be the cause for the damage. Okay. Reason. Amyotrophic lateral sclerosis, ALS short full form. It is also degenerative disorder of the motor neuron. Okay. Epilepsy, chronic pain, brain disorder. It is characterized by recurrent seizure. Chronic brain disorder. It is epilepsy. We know that just in chronic seizure, mull or ictal event. It is a disorder also happen in our brain and give the response with the help of our body. The body will react now due to this reason that. So you can see but all these absence seizure, peptic mull seizure, it is seizure part, post ictal event, it is seizure part. Temporal lobe epilepsy happen, complex partial seizure happen, Huntington disease it is also hereditary disorder marked by degeneration changes, multiple sclerosis, destruction of the myelin sheath, demyelination, demyelination mean loss of myelin insulation. Okay, it is loss of our everything, loss of muscles you can say, and like gait, na gait, gait mean manner of walking. Okay, how we like walk properly or not properly we are walking. Myasthenia gravis, it is autoimmune neuromuscular disorder. It is disorder. Palsy mean also partial complete loss of motor, and Parkinson disease, degeneration of neuron in the basal ganglion occurring. Degeneration, all these things are degeneration. Okay, okay. So like the doctor give right the deficiency of dopamine, na, neuron transmitter made up of cell in the basal. Deficiency happen due to this disorder happen. Palliative related symptom, but not curative. It is a medicine. Tourette syndrome, it is involuntary spasmodic twitching movements uncontrollable. In this Tourette syndrome, it is also abnormality. Alzheimer's disease, degeneration, loss of brain, parenchyma, neuron tissue. It is disease. Here we can see the same thing. Sulci, Garai, language is ventricle, normal Alzheimer. Right hand side is Alzheimer. Something abnormality happen. Okay, and left hand side it is normal. You can see it is normal at that place. Okay, so some gap happen in this, that is abnormal condition. Demyelination, like degeneration of myelin sheath. Okay, demyelination means degeneration of myelin sheath. So happen this mask like face, muscle rigidity become tremor, it is abnormality. Okay, when it our these muscles now become degenerative, na this myelin sheath become degenerative. Okay, become abnormal. So this happen. Okay, muscles will shake, our hand will shake, hip and knees will shake, flagged or shake, elbow flex, become weak all this part. Okay, this is a Parkinson disease. Okay, in this primary symptom it is all things will shake and become weak. Herpes zoster it is a viral infection it is. Okay, herpes zoster is a viral infection. Meningitis means inflammation of the meninges. Okay, leptomeningitis we can say also. HIV, human immunodeficiency virus. It is a brain disease or dementia occurring in this. Okay, okay. Neoplastic disorder, it is brain tumor, abnormal growth of the brain. That is brain tumor means abnormal growth and become brain, or we will call like it is tumor. Glioblastoma, meningioma, tumor, it is meningioma tumor, glioma tumor, astrocytoma tumor, astrocyte glial cell, oligodendroglial cell tumor, ependymo tumor. This is tumor of that part. Cerebral confusion. Cerebral confusion means type of traumatic brain injury caused by the blow to the head. Like some accident happen, na? In this confusion and contusion both are happen. Okay. So it is traumatic brain injury caused by the blow to the head. It is something blowing. Okay. Due to the fracture, na, that area will blow. So this is usually no evidence of structural damage to brain tissue or loss of the consciousness may not occur. Rest is very important after the confusion because it is allow the brain to heal. Doctor commonly recommended avoiding demanding mental and physical activities. So it's confusion type of traumatic brain injury caused by the blow to the head. Okay. So when an accident happen, na, something come out from our brain, na, there is confusion. cerebral contusion, like bruising of the brain tissue resulting from direct trauma to head. So it is a main contusion means directly happen it inside our brain. Okay, it break down that area and make the bigger major problem. You can read this. Okay, cerebrovascular accident it is also the part of accident. Okay, in which the disruption in the normal blood supply will happen. Thrombotic means blood clot happen. Thrombus blood clot. Okay, transient ischemic attack. This is dysfunction. Okay, embolic mean embolus like dislodge thrombus. Clot it is also the clot type. Okay, hemorrhagic means cerebral artery breaks and bleeding occur. Hemorrhage means bleeding will start. Okay, aneurysm means weakened area in a vessel wall. Okay, that is aneurysm. And tissue plasmagenic activator is a clot dissolving therapeutic treatment. Migraine means severe recurrent pain. Okay, in our brain area. So here now you can see blood flow freely through a normal artery. Hemorrhagic stroke are caused by cerebral artery. Okay, hemorrhagic stroke happening, thrombolytic stroke happening. This all will you can okay, you can read this. This is laboratory treatment. Tests are there. Cerebrospinal fluid analysis. They take the fluid from our brain area for the test. X-ray are the cerebral angiography they do for take the picture of our brain. CT computer tomography they take to take the picture. MRI they take. Okay. PET scan also take to identify the tumor. Okay, if the any tumor, any cancer part, no, in this we do PET scan, PET test. Okay, Doppler ultrasound also we do, but it not help much. Electroencephalography we do, lumbar puncture we do, take the fluid from our lumbar region. Stereotactic radiography is the treatment use of a specialized instrument to locate and treat target in a brain. Gamma rays, anything putting there, they are taking the fluid from this area. Okay, cervical area and all this thing. You can read this full form it is. Okay, so like the above, uh, like in our hand, na, humerus are there, radius are there. Humerus is the like you can see humerus is where. Okay, in our like top bone of our hand. Radius is down bone. Ulna nerve, it is nervous. Ulna mean yes, radius ulna and humerus is the upside and radius ulna is the in lower down in our hand, near the wrist. That is the artery, left anterior cerebral artery, left middle cerebral, right anterior, right middle, right internal carotid, left intercarotid, left common carotid, right common carotid. It is the artery. This is the exercise. This chapter has completed. Just read this, whatever we have written. This is all of that. So this is completed.